The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, wherever you are in the world. You'll be good morning or good evening, depending on whether you're in Canada, where our presenter Jennifer is, or you're in Australia, where some of our good friends are as well. This is an ISQua webinar, and you're very welcome. Jennifer Zellmer is delivering today's webinar, and the title of Dr. Zellmer's webinar is Effective Communications as a Foundation for Health, Leadership and Management. I will just introduce Dr. Zellmer and then mention a couple of other aspects of the webinar that you should know. Dr. Jennifer Zellmer leads Canada's Health InfoWays clinical adoption, innovation and consumer health initiatives, as well as the communications function. Previously, Jennifer held a series of progressively responsible leadership positions, most recently as Chief Executive Officer of the International Health Terminology Standards Organisation and the Canadian Institute for Health Information. Dr. Zellmer has worked or has been involved in projects all over the world, including her home country of Canada, in Denmark, Australia, India, Hong Kong and other places. Dr. Zellmer has a PhD and an MA in economics from McMaster University, and she's the editor-in-chief of Healthcare Policy. She is also an adjunct faculty member at the University of Victoria School of Information Science. Dr. Zellmer serves on a range of health-related advisory committees and boards. She's an ISQua expert and a good friend of ISQua. I would remind you that if you have questions during the webinar, please type them into the question box and I will ask those questions on your behalf at the end of the webinar. I'd like to hand over now to Dr. Jennifer Zellmer.
Thank you very much, Peter. Can you hear me okay?
I can certainly hear you, which means yes, we're fine. We think you're coming through loud and clear.
Excellent. And you should now be seeing slides up on the screen as well. Is that correct?
That's correct.
Perfect. So logistics out of the way. Thank you to everyone on the call today for joining us for today's webinar, or for those of you who will be listening to this recording afterwards, welcome as well. It's my pleasure to participate today and share with you some thoughts and some resources in terms of effective communications as a foundation for health leadership and management. And really, my ambit for today is an overview of the fundamentals of effective communication, an opportunity to both share with you some relevant resources that I've found for ongoing learning, as well as to encourage you to participate in the dialogue by sharing resources that you found helpful. And then to talk about some of the opportunities and challenges for improving communications in the health sector, because of course they're so fundamental to the work that we're all doing in terms of quality and safety. I think one of the things that's helpful to me in thinking about this topic is to remind myself that communications has been recognized as key to health and healthcare for centuries. If you look back at a variety of ancient texts or more recent ones that talk about healthcare and how to improve health and healthcare, you see a thread and a strand of the importance of communication running through them. And indeed, the survival of some of these ancient texts offers testimony to the value that generations have placed in sharing knowledge about health and healthcare and in improving that over time. So in today's webinar, I want to talk a little bit about the importance of communication for health and healthcare, both personally and in a clinical care context, as well as at the leadership and management level. And then explore three main areas: the importance of communications competencies, the importance of effective planning and strategy for communications, and the importance also of communications infrastructure as a driver of change. So starting with the personal, one of the things that I was reflecting on as I was preparing for this webinar was to think back in terms of the importance of communication in setting the framework for health and our expectations and our culture around health. And I was thinking back to the first lesson that I remember having about health, and it was when my parents dragged me over to an exhibit that had an exhibit of a dirty lung and a healthy lung as sort of the object lesson in why one shouldn't smoke. And there was, of course, that explicit component of communications as part of that. But there was also a very implicit communication that occurred as part of that experience. My mother was a public health nurse, and it was very clear to me at a very young age that the most important thing I had to worry about in terms of not smoking was not the long-term consequences for health, but was the immediate short-term impact that would occur if my family ever found out that I had even contemplated smoking. And so from a very early stage, all of us are shaped by the communications that we see in terms of what constitutes health, what constitutes healthy behaviors, and the environment and cultural expectations that shapes. But primarily in this webinar here today, we're also talking about communications in the context of healthcare. And those communications are becoming ever more important because of the increasing complexity of health systems. Because also of the desire in our health systems for richer engagement of patients and staff as a way of improving quality, as a way of improving the patient experience, and also the emerging mechanisms and different approaches and opportunities we have for communications as well. So we live in an environment today where individuals may receive care in many different contexts, for many different types of both formal and informal care providers. And that complexity reinforces the need for communication. You can see that, for example, in this survey work done by the Commonwealth Fund. More healthcare providers. In this case, the Commonwealth Fund was measuring that in terms of the number of doctors that patients had seen. But those who were involved in with more healthcare providers were much more likely to report these types of issues in their care. Obviously, their health situations were more complex, but equally we know about the risks in terms of continuity of care, handovers, transitions of care, that make communications in this kind of context ever more important. And so that's a critical dimension for individuals in the health care that they receive. But communication and effective communication is also an essential part of leadership and management capacity. What you see on the slide now comes from the World Health Organization's framework for building leadership and management capacity. And you can see that in addition to the pure questions in terms of things like the adequate number of managers, all of the other dimensions have a communications element. The appropriate competencies that leaders and managers would have, including around communications and teamwork, an enabling work environment that is supportive of effective communications, that encourages communication to occur, and functional support systems that make it easier to have effective communication and teamwork, all of which being essential for improving health services and achieving health sector goals, regardless of the setting that we're in terms of the level of resources or the piece of the health sector that we may be most concerned with. So if I focus in for a minute on the competencies element, what you see on the slide now is a series of competencies that were developed, and you can see slightly different flavors from slightly different groups, and at the end of the presentation I have a number of resources for those of you who may wish to go further and explore this further. So different organizations have developed slightly different categorizations of leadership competencies. This particular one comes from a set of groups actually in Canada, but focuses on a number of competencies for leaders, many of which are underpinned by and with effective communications. So if you think of, for example, the leading oneself, that includes understanding how one is perceived, being self-aware, including of our own assumptions, values, principles, strengths, and limitations. If we think about engaging others, of course, communications is critical in that regard. For example, listening well, encouraging open exchange of information and ideas, using appropriate communications mechanisms, or building teams, facilitating environments with collaboration and cooperation, fostering the development of others, again, helping others to support their professional and personal goals, or indeed contributing to the creation of healthy organizations, including environments with meaningful opportunities to contribute and fulfill those other expected responsibilities. Similarly, if we look at developing coalitions, that again would be underpinned by effective communications, whether it's in terms of purposefully building partnerships and networks, or mobilizing knowledge, or navigating what can be quite complex socio-political environments, or indeed demonstrating a commitment to customers and to service. All of those require communication skills. And last but not least, if I look at transforming health systems, successful leaders encourage and support innovation. They orient themselves strategically to the future. They champion and orchestrate change. All of those require and are underpinned by effective communication. So these competencies are examples of the types of ways that communication are expressed and the ways that those competencies can contribute to effective leadership and management in a caring environment. So maybe just to give an example, because examples I think are always more compelling in terms of illustrating what we're talking about. And I want to talk a little bit here about the example of hospital standardized mortality as it was evolved over a number of years in the Canadian environment. HSMR, as it's called, is obviously a metric, but more importantly, it's embedded as part of a quality process. And so the work really began with a coalition for leadership on safety that included a range of organizations from across the country, organizations that were focused and organized around patients, around quality, around clinical care, around governance and accountability, and so on. All of those organizations coming together to be able to say, here is how we think that we can improve care for Canadians and improve the safety and quality of that care. As part of that process, there was a desire for what's sometimes called a big dot measure, something that could be an overall focus for organizations, that then would cascade into a series of more detailed measures that could be used within the organization to both focus quality improvement attention, but also at a granular level, maybe on an individual unit, to look at quality improvement and the impact of specific quality improvement processes. So this effort began with a communications effort around building this coalition, but then extended beyond that coalition to build a case for why hospital mortality mattered. That it needed to be explicit in terms of why this big dot measure was being looked at, what were the opportunities for moving the dot, was this something that could be changed, what might change it. And so there was a process over a couple of years to review the methods behind the metric, to clarify and confirm the data, and probably most importantly, to link the use of that metric into broader campaign around Safer Healthcare Now, and around effective governance for quality and safety that would really ground the measure as part of an overall improvement effort. Shortly before the release, there was a specific pre-release process to make sure there were no surprises, that everybody had the tools and supports that they needed to be able to understand the measure and how it fit in with their broader plans. And then there was a structured public release that very importantly focused on what the measure was and what it was not. That led to follow-up with individual hospitals, tools, a series of dialogue opportunities, as well as individual follow-up with patients. So individual patients came forward in terms of their own experiences and wanted those reflected alongside, as their experience, alongside the metrics that, of course, reflected the experiences of many patients. And this needed to be and was a continued process, and shortly after the release, I spent some time doing a secondment with one of our health regions, and the process that they were using to look at quality improvement across their whole health region. And as part of that process, of course, they needed to communicate very broadly with the patients and families, with their community, with their staff. And it became clear that they had the motivation, they had the commitment, they even had many of the competencies to do this, but they lacked some of the structures and tools that they needed. So for example, the most reliable way that they had, and this is a number of years ago now, since changed, but the most reliable way they had at the time to communicate with all of their staff was to staple a written communication to their pay stubs and put them in the mailboxes at the end of the month. Now, while that reached most staff, it was a very limited opportunity to communicate and certainly didn't allow for a dialogue or an interaction. And that's just one of the examples where, effectively, healthcare doesn't look very good on paper. And as our communications tools evolve, different tools that we're using now these days in every aspect of our lives, it's incumbent on us as leaders and managers in the health sector to think about how can we take advantage of those kinds of advances to improve and facilitate effective communication about health and healthcare. Some of you may be familiar with the work of Eric Topol, and certainly he's written very powerfully beyond healthcare, but also in the health, in terms of the health sector, regarding how the digital world, and particularly he's pointing out the internet, the cloud, supercomputing, social networking, how that's fundamentally changing the context of both health and medicine, and how that will affect the types of care and the environments for the health sector on an ongoing basis. I just wanted to spend a couple of minutes on some examples in that regard before we go on to some of the evidence and some of the approaches. Perhaps most obviously, the impact is in terms of the use of telehealth. So you see on the upper left-hand side of the screen a mother and her young son who are involved in a telehealth consult with a pediatrician who's many, many miles away from them. And so we see particularly, and perhaps most obviously in rural and remote contexts, how video consultations, how telehealth technologies can help ensure that care is available when the patient and the provider can't be in the same place at the same time. And it's not just about formal provision of care either. So one of my favorite examples of telehealth comes from the north in Canada, where from some remote communities, particularly for individuals with potential complications, pregnant women often have to fly out of their communities to deliver their babies in the south. And this means that for a period of several weeks, they can be away from their home community. And so increasingly, telehealth is being used to bridge that gap, including in some cases for communities where a naming ceremony for that community within a given period of time is a very important part of a recognition of the new baby and its belonging in that community. So telehealth is being used to connect communities with parents and their children who may be away, to officially welcome them and to join in with them as part of that community. So there are formal aspects of healthcare there are also aspects of health that can take advantage of new technologies as well. The second example comes from the primary care sector, and it's looking at the ability to take advantage of new communications technologies to support proactive outreach for preventative care. And we see this in a number of contexts, from low resource settings to high resource settings, where everything from simple text messaging to much more sophisticated technologies are being used to both identify people who would benefit from proactive outreach and then to reach out to them and invite them to engage either in self-management of chronic conditions or in outreach for preventative care. So there was a study done recently in Canada, for example, that compared the ability of primary care practices to identify individuals in their practice who would benefit from 6 types of proactive outreach. Everything from identifying individuals with diabetes who had not had a recent foot exam through to a mock drug recall in a situation where you needed to quickly identify individuals and reach out to them. In all cases, the practices that were using electronic records were able to identify their patients who would potentially benefit from these interventions more quickly. But they were also more confident that they'd been able to identify the right patients to reach out to. Whereas a number of the paper practices that participated in the study actually exhausted their capacity to review charts. They timed out on the study, if you like. And in fact, one of the staff participating threatened to quit if she had to continue to do the process of identifying these patients because it was so cumbersome in a paper environment. So in some cases, new tools enable communications with patients in a very different way and targeted communications that's directly tied to their needs. We also, of course, third example, see different uses of social media and big data for everything from public health surveillance to building communities of practice among health professionals to reaching out to groups of patients for social support. So how does this all fit together? Systematic review from Health Affairs that appeared in 2011, and this is a world that's moving pretty fast, so in some senses this systematic review is actually already dated at this point, that looked at a variety of aspects of quality of care and attempted to do a systematic review of the studies that had been done on different types of health information technology, evaluating whether overall their results had been positive, mixed positive, neutral, or negative. And you can see the division on your screen that overall positive, but a number that were in other categories, which reminds us about the importance of ensuring, both in the case of the use of health information technology and more generally in terms of communications, that we have processes in place to evaluate and respond to the effectiveness of that communication and ensure that we can adapt accordingly. If we do think of the overall, though, I'm reminded of the words of Don Berwick. Many of you may know Don. He, of course, led the Institute for Healthcare Improvement for a number of years, then moved on to the federal government in the U.S. and is now engaged in Massachusetts. And he spoke about health IT as culture change. He talked about the fact that it's better for everyone, for patients, for providers, when health IT is used meaningfully. But why aren't we there yet? It's a bit the question of the little child sitting in the back seat of the car on a long car journey. Aren't we there yet? How much longer? Why isn't it there yet for everybody, for all the patients, and not just the lucky ones in modernized systems? And his answer was that because it's hard. And moving from paper legacy systems to modern IT is a big change. And like any big change, it's really a new culture. You don't get there in one step. But we have to get there, and a big part of that process is about effective communications, as it is for any transformation effort in the health system. And so we're coming to a stage where, it's words of Winston Churchill, which my boss sometimes says make much more sense after one has had a suitable quantity of scotch or your favorite drink at the end of the day. But I think it makes sense even at 9 o'clock in the morning where I am here. Now, this is not the end. It's not even the beginning of the end. But it is perhaps the end of the beginning. And that process is partly because communications are changing, and the context of communications is changing as well. So just to get things started in terms of our conversation on the webinar, here are a number of ways where I think we're seeing communications changing. If we think about the overall movement in terms of the more proactive engagement of patients, families, clients, citizens in health and healthcare, sometimes encapsulated by that phrase, nothing about me without me. That fundamentally changes the culture, the approaches to communications, and the structures that we need for effective communication. Equally, within the context of clinical care, we have a number of new structures, new approaches, new methods of training that support effective communications, whether they're things like SBAR or whether they're things like disclosure guidelines in the case of patient safety events. We also see new types of leaders emerging in social media. So there continue to be very important, of course, formal leadership structures within the health sector. But equally, we see new voices coming, both enabled by and supported by broader networks in social media. So, a proactive communicator in who's a resident, for instance, may have a reach and an ability to communicate that is as broad or even in some cases broader than people in more formal leadership structures. We're also in a world, social media brings us to a different world in terms of some types of communications. So if we think about crisis communications in, for example, a public health emergency, how do we do that effectively in 140 characters on Twitter? What are some of the approaches that can be used to ensure effective communications in using some of these new types of media? How are we conscious of and supportive of the need to recognize the digital divide, that not everybody has equal access to these types of tools and resources? Although, interestingly, the evidence on this is mixed, that effectively done, actually, digital communications can reach many people with lower income and lower education as well. So how do we also take account of the changing context in that regard? And similarly, many of us are working in environments, both in terms of the mix of people who work in healthcare and also the mix of people who are receiving health services or engaged in health services, where we are cutting across cultures and we are cutting across linguistic boundaries as well. And that raises both opportunities and challenges. So I'm reminded in that regard, I lived in Denmark for a few years not too long ago, and particularly at the beginning of my stay there, my Danish was not very good. And I went in for a consult with a healthcare provider who was a lovely person and meant very well. And the resident in that context spent, probably 15, 20 minutes talking me through the results of the test that she'd done that way. And frankly, my understanding of what she said was I knew the word for normal and I knew the word for not. And those two words did not occur in conjunction with each other. So given that it was a regular follow-up test and I'd had one 6 months before in a language that I did understand, I figured that all was well. And then by the next visit, my Danish had improved sufficiently that I could actually understand and engage in that conversation. And that's possibly a trivial example, but if you think about that writ large, we're dealing with much more complicated situations with multiple cultures, multiple languages, multiple contexts and expectations for quality that influence quality and safety as well. So I'd be interested as we start this conversation on the webinar, and feel free to start adding notes in to Peter on the comments page, in terms of what do you see as some of the key factors changing the landscape of health and healthcare communications today? What are some of the things that you've seen in your experience that may be relevant for others in terms of complicated or more complex situations to think about and deal with, or approaches that you've found to be effective in overcoming some of those challenges? So speaking which, another one of the goals of the webinar was to talk about what kinds of resources might be available for ongoing learning, and tools and resources that you may want to dip into depending on your particular interest in the area. So I've put together a few examples of starting points here, but I'm also hoping that everyone on the webinar, whether you're on the webinar today or for those who are listening to it later on, can also add in and share your favorite resources through the forums on the ISQua website as well, or through the webinar dialogue today. The first couple of resources on this slide are more general references in terms of some of the tools for effective communications or approaches to communications. I'm sure everyone is probably familiar with the TED Talks type series, and there's a large number of TED Talks that have focused on communication and effective communication, including in the health sector. I've also included the Canadian Patient Safety Initiative's Framework for Teamwork and Communication, which includes a number of additional resources and links to additional resources, as well as the disclosure guidelines, which similarly include links to a range of resources there as well. And I'm hoping that these types of resources will be useful starting points for those of us who wish on an ongoing basis to continue to develop our competencies in effective communications as the world and context in which we're doing those communications changes. I've also included a series of resources on the next slide talking about communications really at a broader system level. And in many cases, these are about communications that support change efforts writ large. So some resources that are specific documents, as well as a number of sites that provide links, tools, and ideas, as well as opportunities for conversation about how effective communications can support transformation within the health sector, or more broadly from a public health point of view, within a public or population health point of view, within social change efforts as well. So in particular, if you haven't yet had a chance to dip into the NHS change model, I found that very helpful in terms of thinking about the ways that one promotes change and what are the points and priorities for communications in that kind of context. And I've also included a link to the Pan-Canadian Change Management Toolkit there, which references a broad range of resources from Canada and around the world that provides, in some cases, more specific tools. So for example, on the next slide, the communication planning template, which really allows you to work through in a structured way for any given initiative that you may be thinking of. What are some of the ways of assessing a given audience? How important are they to the success of your change initiative? How the change might affect their audience? What kinds of effort would be needed to change for that particular group? The types of concerns or issues that they may have, what they need to hear about, what they need to understand, what kinds of change might be important to them, and then, of course, how you might address that as part of a communications plan and strategy. And so there's a mix in terms of the resources of these kinds of concrete tools, along with much broader approaches in terms of overall communication skills, knowledge, attributes, and the ability to do things like mobilize knowledge or build coalitions or think about very broadly effective communications to support quality and safety. So with that now, I'd like to open it up, and Peter, I guess I'll turn things back to you to facilitate this session. In terms of any questions or discussion points that you may have, in terms of effective communications, again, is that foundation for health leadership and management.
Dr. Zellmer, thank you very much. That was a great presentation, and there are a number of takeouts from that for me personally, and I think one of the important ones for me is a reminder that effective innovation depends on good communication. That's something we sometimes lose sight of. I have a number of questions, and the first one comes to us from a participant in Ireland. There is so much communication noise out there. How do you capture the attention of key staff effectively and ensure that the message is heard?
That's a very, very important question, because I think both within the roles that we may have within the health sector, but also in our general lives, we are bombarded with different messages from different sources. A couple of things that I found very effective. One is actually, if I go back to that set of communication planning tools, so it's really focusing on what is important to that audience, what will allow you to focus on the messages that are important to them, the mediums to achieve them. So what are the channels through which the people who you're trying to reach receive communication now? And how can you take advantage of those channels? So I'll remember a couple of years ago we did an exercise with very senior leaders within the health sector. And a key question that we asked them was, what is the one source of information that if it was missing, you would go to find it? And their answer was the daily clippings from the newspaper that are relevant, from the newspaper, the TV clippings, and so on, that are relevant for my job. So that insight allowed us to focus on, we could do direct communication with those leaders, or we could complement that with communication via the media and making sure messages got into the public media that would reach them through a channel that was already important to them and that they were already highly motivated to review and look at in a timely way. A second strategy that I've also found very effective is a peer leadership strategy. So it's well recognized that we learn and listen best from folks who share our experience and share our context. And so we've often used peer leadership strategies to marry people like us, or folks like us, with others like us, and to be able to do, whether it's a train-the-trainer approach for peer leaders, or whether it's leveraging knowledge and skills they already have, but giving them the time and support to be able to engage with their colleagues to share and communicate those messages as well.
Thank you, Jennifer. The next question is about the role of education in communication. It's hard to argue against the benefits of better communication, but how do you bring that about in healthcare, and what is the role of formal education in improving communication in healthcare?
I think the role of formal education is essential. Effective communication does involve a series of competencies. And in some cases, there are tools we need to learn. So if you're working in an environment that has agreed that SBAR will be a key strategy for effective communication, you need to know what that is, you need to know how to use it, and you need to practice using it, all of which can come through formal communications. Equally, a number of the sort of more structured tools and resources for ensuring that you've got an effective communication strategy, that you've worked through effective communication approaches, can also come through formal education. That said, I think it's equally important that we recognize the value of ongoing learning and ongoing development. in terms of effective communication, because the context in which we're communicating is changing. And we also need practice. I mean, Peter, you and I were talking before the webinar started about learning languages. And just to use that analogy for a second, I think language learning is best when you're immersed in that context and you have a chance to practice. And all of us, whether we realize it or not, are communicating with our colleagues, with others every single day. And so an ongoing learning process to try and improve our effectiveness at doing that is also a very important part, I think, of being an effective leader and manager.
Jennifer, the next question comes from Africa, and it relates to issues particularly in Africa. And first of all, you're thanked for a great webinar from John, and he says that in Africa we still face many challenges with many more patients and too few health workers, which doesn't allow us enough time for effective communication. There are also the challenges of the digital divide that leave many people excluded. So with these challenges, how do we go about improving communication?
It's a very, very important question, and I wish I had an easy answer. There are a couple of things that I've found helpful to keep in mind. The first is that there may be, you may be able to hold hands with friends, if I can put it that way, in terms of communication. So there may be approaches that can be used in terms of patients, families, community members as peer leaders for others in their situation. So that effective train-the-trainer models where you're training one and then having them share the opportunity to communicate effectively with others may be very helpful. And that's an approach that can be effective in context with a whole range of different levels of resources, but is perhaps particularly relevant in low resource settings. So that can be helpful. Another is to think about where are the communication opportunities as well. So are there ways that we can achieve efficiencies on one hand that allow us to spend more time on communications on another? When I was working in India, for example, at one point we introduced in local primary care centers some approaches that streamlined the reporting that they needed to do to government. It was part of their accountability reporting, and historically had been a very time-consuming process. And by streamlining that process, we were able to release time from local health workers to be able to spend more time communicating with patients and families. So are there ways that you can take advantage of those opportunities? The digital divide issues are real. They're important. They are changing fast. So it may be a situation, for example, of are there opportunities, for instance, with text messaging that can be used, rather than thinking about a very sophisticated web-based portal. And in fact, in some cases, the evidence is that those kinds of strategies can be even more effective. Are there other types of approaches that you can use in terms of shared resources in a community where there may be a broad need for communications? Not everybody has access to those resources, but can you again use that peer leader type approach or the train-the-trainer kind of approach to take advantage of resources where they exist? I hope those are helpful starting points, and included in some of the resources that I've included on the slide in terms of system-level starting points, some of the issues around communications for social change and the Communication Initiative Network. I think you'll find some additional ideas there that I'm hoping will be helpful to you as well.
Thanks again, Jennifer. A question now from Japan. The systematic education about strategic communications is important for all. What do you think is the relationship between evidence-based medicine and facilitation and effective communication?
I actually think they go hand in hand. So if you think about the evidence in terms of the time that it typically takes for a new piece of research that's been published in the literature to make its way into being a standard of clinical practice. That gap is often measured in years, sometimes more than a decade, depending on the area that you're looking at and the way that you measure. That's a very long time. And it's effective communications that will help to shorten that gap. So to shorten the gap between what we know and what we actually do. And so that's where I think the combination of thinking about strategic communications frameworks as a way of improving evidence-informed healthcare, evidence-informed medicine, and making that easier to do than not to do. So just to give you one specific example, I was recently doing a site visit at a hospital here in Canada, and they have introduced evidence-informed order sets. So these are structured sets of things that the clinicians in that environment have agreed are the most appropriate to do for patients with a given type of condition, maybe pneumonia or other types of health problems. There are, of course, always options that if something's not appropriate in a particular case for a particular patient, you can take that off. But it's a starting point. What this particular hospital did was they embedded within that order set short and long links, and including links back to the underlying article that was the basis, or articles that were the basis for that recommendation, to the evidence. And that was important for the clinicians at the front line of care because they could easily and readily access that evidence at the point at which it was relevant and important to them. And so those kind of links allow that connection between the evidence and between care, and are the fundamentals from the structures that support communication all the way up to the overall strategy for ensuring that effective communication is occurring.
We move rapidly now from Japan to Canada for a question from Françoise. How do you foresee the evolution of accreditation standards and their application in the context of greater user participation in social and healthcare organizations?
Oh, wow. That's a broad question for sure. I think we're already seeing some evolution in terms of the roles in some contexts of patients or patient representatives as involved in the definition of accreditation standards, involved in the survey process in different ways. But I think it's still quite early days in that regard. When I've been speaking with patient groups and patient representatives, they are looking for a much more dynamic role in terms of how they can contribute to better health care and to a better system for them, for their communities, for their families. At the same time, I think we also need to recognize that patients have other things happening in their lives. And so we need to be respectful of their time, of their ability to engage effectively in the accreditation process. And it's a balancing act in terms of how to enable that, that I think we're collectively, globally still experimenting with in terms of what works best in different contexts and what will also work best over time, because I suspect that the ways that we engage now are not the ways that we might engage in the future. If I take, for example, the involvement of patients and the changing involvement of patients in terms of things like reporting issues with their care, in terms of things like contributing to post-market surveillance of medications. Those kinds of interactions are very different than they were even 5 years ago. And I expect they will be different 5 years from now from where they are today. So it's a bit of a long answer to say I think it's changing. I think it's one of those examples maybe of William Gibson's quote that the future is already here, it's just not evenly distributed. And so different accreditation bodies have been experimenting with different types of approaches. And indeed, we see different types of patient-led initiatives as well, rating doctors, rating hospitals, rating long-term care facilities online themselves in a very open way on websites. That I think we have a lot to learn from those different types of approaches in different settings to be able to evolve that engagement and involvement in accreditation processes in the longer term.
A question now from Brian here in Ireland, and it's one that I would dearly like to know the answer to as well. I'm sure many people would. What is the most effective social media platform for communicating with, on the one hand, patients and service users, and on the other hand, service providers? And what kind of information is best shared on social media?
Oh, wow. You know what? You're not going to like my answer, either of you, I'm sure, because the answer is going to be it depends, unfortunately. So why do I say it depends? If we think it depends on the one hand because different groups of individuals interact with social media in different ways. So different age groups, different cultural groups, different linguistic groups have different ways and different propensities for using social media. We're involved right now, for instance, in a public health social media challenge where we've challenged public health organizations from across the country to use social media to reach their key target audiences. And the campaigns that are involved are very different. They're addressing very different issues. They're addressing very different populations. And so as a result, they've needed to use different types of social media approaches to reach them. So in some cases, people are using a multi-channel communications approach where they may be integrating the use of Twitter and YouTube and other types of blogging approaches as well. We've got, at InfoWay, we've got a public education campaign that's been running for the last several months. And that's the approach that we've been using. It's been a very multi-mode form of communication in that particular environment because that campaign is really based around stories and the individual experiences of patients and care providers. For the public education campaign, one of the large components has been a YouTube component. And we've had over 2 million views of those videos in the last 6 months. At the same time, we've also been running a clinical education campaign. And on that front, some of our most effective ways of reaching clinicians have been via social media networks with organizations they are already engaged in. So for example, the networks operated by their health professional associations or their unions or their employers for those that have social media presence as an employer. We're using LinkedIn in that context because it's more of a professional communications avenue. So the social media strategies, even for those two groups, are quite different because of the ways that we're trying to reach different groups with different messages as well. The last thing I'll say on this topic is that the social media sphere is also changing. So, a couple of years ago, wouldn't have thought necessarily about using Pinterest, whereas now Pinterest is quite effective at reaching certain groups with certain types of messages. But the structure of those messages has to be appropriate for the social media channel that you're using. So for example, if you're using an emotional kind of argument, or if you're using a more fact-based argument, those types of arguments fit better with different types of social media platforms, either because of the length and space that you may have, or because of the ways that people are used to interacting with those particular social media channels. So I hope that's at least a starting point. You will find in a couple of the resources in the Communications Initiative Network in particular, and also in the TED Talks about communications, some links in terms of how different people are recommending that social media might be used. But it is very much also, I think, to be fair, an area where there's a lot of learning to be done about what does work best.
Thank you, Jennifer. Last question coming up now, and I'm indulging myself as organizer of the webinar to ask a question of my own. One of the barriers to better communication that is often raised by clinicians is that it takes time. How can we convince these people that ultimately better communication actually saves time?
A very important question, and you have sympathy, right? Because clinicians are busy people. They've got, and they're trying to provide care to all of their patients, and so it's a serious issue. And I think the process begins by acknowledging the seriousness of the issue. I think it also goes through and goes back maybe to the question that was asked earlier in terms of formal education. There are formal tools for communication that can help to make communication both more efficient and more effective. So in presenting that in a way that acknowledges that efficiency matters is sometimes helpful in terms of opening minds to the importance and the willingness. I think everybody would agree on the importance at a philosophical level, but also the practicalities of it, I think. It's important to acknowledge that. Equally, formal education can be important in setting norms and expectations for behavior. So the fact that effective communications and what effective communications involves is an expectation of your role as a clinician needs to be set from very early and needs to be continuously reinforced as well. And I think that happens through formal education, through also the norms and standards that we set for those who are working in the health sector. And I think the other thing that I had a real reminder of this recently, it's important, the feedback is also important about the value of effective communications and finding ways to get that feedback back to those who are involved, because there's not always that opportunity. So I was looking at a new video consult tool recently, and so this is for patients and providers to engage in an e-visit using video conferencing, but at a desktop level, so from your home as a patient. And at the end of the visit, there's a very quick feedback for the patient. So they get to do a happy face, neutral face, sad face, but then also to include a short comment in terms of that communication. And 24 hours after the provider's shift doing these video consultations, there's a summary of that feedback that's sent back to the provider. And the value that the providers involved described from that communication back was phenomenal. This was one of the first times they'd ever gotten feedback in terms of the importance of that communication and the ways that they'd been able to communicate with those patients. And I think sometimes we haven't taken advantage of that last feedback loop back in terms of the reinforcement of the value and importance of communication as well. I hope that's some helpful thoughts, Peter, on what could be a very long conversation.
Thank you. We'll continue it elsewhere, I'm sure. Jennifer, thank you. Look, we're right on the hour. That was a terrific presentation. It was good on a number of levels. It was thoughtful, and we're starting to get some feedback on the presentation already, saying that it was clear and highly practical with tools to take away. So thank you very much. And I'd remind the participants that this webinar will be available on our website subsequently. And of course, you'll be able to, when you visit there, you'll be able to pick up the references that Jennifer has given us today. Jennifer, thank you again, and we look forward to continuing to work with you. Thank you.
My thanks to you, Peter, and for everyone for being on the call today.